I'm a fellowship-trained breast surgical oncologist. I'm Dr. Mani Jambakar, and welcome to my October myth busting series, where I bust a different myth about breast cancer every single day of the month. Today is the last day of my series. Happy Halloween, and I am busting the scariest myth of all. And that is that if you have a family history of breast cancer and negative genetic testing, you are not at increased risk for breast cancer. This is a made-up case similar to patients my colleagues and I have seen in the past. This is a 58-year-old female who has a strong family history of breast cancer. Her mother was diagnosed at 65 and her grandmother died of the disease at 78. She underwent genetic testing in her 40s and it was negative, and because of that, she believed that she only needed to do a mammogram every other year. One year she had her mammogram, and this is what it showed. You can see clearly there is a spiculated white mass. Spiculated means jaggedy edges, and there's a bunch of these little white dots or calcification. She underwent an ultrasound guided biopsy and it showed grade 2 IDC or invasive ductal cancer, estrogen receptor positive, progesterone receptor negative, HER2 negative, along with grade 3 ductal carcinoma in situ, or all these little white dots that we can see. She went to see a surgeon in her local area, and the surgeon did a lumpectomy as well as a sentinel lymph node biopsy for her. The good news was that her lymph node came back with no cancer in it, but unfortunately they did not clear all of the cancer out of her breast, and there was some of these little white dots or ductal carcinoma in situ left behind. And then she had to undergo another surgery, a re-excision, to take out more cancer from her breast. Had she gotten a mammogram every single year, she likely would have been diagnosed with just ductal carcinoma in situ, and her surgeon would have had to do a much smaller lumpectomy, and she probably would not have needed a re-excision surgery for a positive margin. So the moral of the story is that even if you have genetic testing and it's negative, but you have a strong family history of breast cancer, you may still be at increased risk. Especially when we can't test the other members of your family. We don't know if they had something and you don't, or if you all carry a gene that we simply haven't discovered yet. So if you are one of these people, I strongly recommend you find a high-risk breast clinic in your area to discuss an imaging plan that is right for you. At the very least, I recommend getting a mammogram every single year.